Hi, my name is Robert Servanski. I'm a veterinary surgeon from Affordable Vets. Today we'll have a chat about what is an emergency. Did you had one in your life with your beloved pet? Possibly. So what is the urgent onset is? What is the sudden onset that you need to see by a veterinary surgeon? Is anything like symptoms which threatens the life? How then is that? Oh, threatens the life. Well, first of all, is always pain. The vital signs ask for unable to breathe normally, cyanotic or blue tongue, or the heat-related distress. Let's say we have a very hot environment in the summer. Well, we do, because recently we had actually really, really high temperatures of the summer. That happens. Yes, you close the doors, you close the windows, the pet is there, just a few minutes, and we just into the shop. And sadly, that 2 minutes can be too late. So read what you need to do. First thing, open the window. Sorry, it's actually not anymore with this way. You're just only pressing the button. And the door's open. Oh, sorry, window is open. We have a little bit of air going in. We can't even turn on aircon. If we have a German Shepherd inside, do you think somebody will come inside and take your things? No, German Shepherd will get them. Simple as that. So be conscious about that. And if it happens, heat-related issues, what you need to do is to come to us. Why? Because we will help you quickly to reduce the temperature of the dog, because the brain will gonna boil. Sadly, that is the truth. That it happens, and it happened previously. So heat-related issues, okay? Heat can get to even 41 degrees. 41 degrees of Celsius. Now, what happens if it's 41 degrees of Celsius in the brain? It actually literally boils the brain. And what happens then? I'm sorry, we lost Freddy. So that's what you need to learn about heats related. And let's go to another topic, because we have a lot of to go through. So excessive panting or drooling in this case, what happens with that? Well, excessive panting can be because of the ingestion something. Excessive drooling, the same. Or foreign body in the esophagus, that can be there. But if you have a dog which is actually has excessive panting, you need to get them sooner than later. Or glazed eyes as well, the same thing, means that there's actually neurotoxicity, can be there as well. One of the major factors which usually happens is collapse and unresponsive behavior. That is super quick. And that's super quick for us. Why? Because we can save life. We can help the pet. And which way we can help the pet? Either surgery, either to find out what exactly is going on. Is it the heart problem? Is it not the heart problem? We don't know exactly, isn't it? So beyond that, frequent vomiting, diarrhea, that straight away tells me, imagine this is a stomach, okay? So this is the stomach, and this is the intestine, okay? And the small intestines and the large intestines. And literally is a tube from the mouth to the back end, sadly, but is a tube. And on that tube, sometimes dogs ingest a happy ball. And what happens then? It's not so happy anymore. Why? Because ball cannot pass through our intestines. And what then happens? Obstruction. And then happens vomiting, diarrhea. Can be viral diseases as well. So it's a lot of ifs and buts, but this is actually an emergency. And I would say really, really, really important, timely matter. Why? Because sometimes you can do incision here and you remove the ball, or you do incision here and that ball comes out and says happy. I'm happy, then dog is happy and everyone is happy, isn't it? So that's the rule. Abdominal swelling, like really big, but no urgency, or pain in this case as well, is an emergency. So we would need to see you again the same way. It could be that something in the liver or kidneys is not working right as it should be. Could be. We don't know exactly. Unusual behavior as well, mental changes as well, that can be there. In unusual behaviors, usually happens that you have a dog which is actually acting not as your dog. So you don't recognize him, or he doesn't recognize you. Then it's a few words for that. It's we always think that we don't have dementia in dogs, but yes, we do. It has a very posh name, though. It has a name of called cognitive dysfunction, but is only and only is dementia. So that is the same thing. It's not as classed as really as an emergency, but it still is really distressful for you and for the pet, because it's howling all the time, because he doesn't know where he is. He thinks that he's actually ate already, so he eats again. He doesn't know that he actually urinated already, and he urinates again, and he's howling at everything what he sees, and then comes back home and he doesn't know where he was. You know that feeling? I don't, but it's really, really uncomfortable, isn't it? Another which one is really classed as emergency is eye redness and swelling around the eyes, or even the eye out sometimes happens, or out from the orbit in this case. And that is emergency as well. Why? Because if we'll place back eye in, we save his eyesight. If we don't rush in half an hour, we may lose the eye. Simple as that. Redness, yes. Swelling, especially on both eyes. Anaphylaxis or shock reaction, likely. So that could be as well in this case to actually be important in this case. Straining for urination or defecation as well can be a problem. Majority of the cases in dogs, males especially, females not so. So let's say you have a dog which is straining for the urination. It's emergency. Straining female, not so, but yes, still need to see it. If straining male cat, it's emergency. Why? Because the urine buildup in the bladder pushes on the ureters pushes on the kidneys. And kidney says, hey, hold on a second. I cannot keep that. Let's release everything in the blood. Releases everything in the blood, and cat starts to vomit. Not eating, behaving really odd, and painful bladder. So that's what you need to remember, okay? Struggling to breathe, of course, is emergency. Super, and gasping for air is super important for the pets to be in here, admitted as soon as. Why? Because their lungs cannot expand. They cannot breathe. Imagine like we have a thorax here, or chest wall, and we have here a chest, just as simple as the graphics, and lungs sitting over here. Okay. This is the heart. I will write down for you to know. This is the heart. And everywhere is here fluids. So what happens then? Do you think the lungs is actually breathing? No, the lungs are not breathing. They're squeezed. They just so, and that's what you see. The pet cannot breathe, cannot expand his lungs as normally would be. There's a little bit of space, but that is only for timers and for the free floating, let's say, fluids in there. You don't need to know about them, but you will know about them. So lungs can actually expand, go back. So it's kind of work this way, back, forth, back and forth. And that is what it actually should be. And if we actually cannot do that, then it's a really big issue. Then we need to kind of have a treatment, oxygen, and so on, so on, so on. So it's kind of, it's really not too great to have been in there. Then we go with a topic which is important as well, is uncontrolled bleeding. I actually had a chat about that in Yaxley. I do remember in 2017. Yeah, in 2017 we had that really nice pictures done about the emergency CPR training for the pet owners. Why I did that is just because I want them, to owners, to know what to do, to prepare yourself, to be ready if you need to do CPR. Because otherwise, you need to rush, yes, but doing the CPR, even in a car, someone can save his life. And that is so important for you because it's your beloved pet. So that's as well is super important for them to do. What I forgot, I don't know exactly. Do we need to have something else? Yes, actually, yes. We usually have road traffic accidents. Do you know how many happened in this year? Google. Or actually, you know what? DuckDuckGo. Better. They will not gonna follow you in this case. That's better way to do it, isn't it? So DuckDuckGo, type in how many road traffic accidents we had statistically. You can find out in humans if you wish, in dogs or cats. Cats in majority of the cases. And guess what happens when this actually road traffic accident happens? The car hits somebody and drives away. Majority of the cases not, but there are some people who actually will do. Or, they want to do this way because they wanted to actually harm the pet. I don't know. Maybe it's something else. I'm not about that today, so we'll not go there either way. But when it's actually a road traffic accident, rushing is actually saving life again. Okay. Suspected of toxin exposures, visibly you can see when the cat is actually covered in petrol. So what do you need to do? Clip the pet and shampoo the pet. If it's actually drunk something as well, vomiting, call the vet. The vet doesn't answer, call VPIS. Sorry, Veterinary Poison Information Service. That is long name, but otherwise it's called VPIS. And it's good because they help you for any drugs for 24 hours a day, 7 days a week, 365 days a year. Is that good? Yes, it is good. Because veterinary surgeon may be busy and he cannot answer. Sadly, it is. So that's what we need to remember. Now, in regards of our visible injuries of the, of course, blunt trauma or any of those, you see that it's actually happened. Brush to the vets, come in here, we give pain relief. Less stressful. You come down, everyone has come down. Adrenaline reduces the everything, and then we are happy to continue. Yes. What else we can actually add? Well, thank you for listening, and see you soon.